Welcome to Nursing 301. This is a recorded lecture for Chapter 70, Sexuality, Fertility, and Sexually Transmitted Diseases. This chapter starts on page 1135 in your book and ends on page 1161. So, sexuality is the way in which individuals physically, emotionally, and socially experience and express themselves as sexual beings. Sexual orientation is which gender or genders an individual finds physically and or emotionally attractive and sexually desirable. Sex can refer to sexual intercourse or gender. Sexual identity is sexual orientation, and sexual gender is one's personal view of sexual identity. Sexual orientation. We have asexual, which is individuals who are not particularly attracted to either sex. Bisexual, individuals who are attracted to both sexes. Cisgender, cis or cissexual. They identify with the gender that was assigned on their birth certificate. Gays are men who are attracted to other men or women who are sexually attracted to other women. Heterosexual, individuals who are attracted to the opposite sex. Homosexual is individuals who are attracted to persons of the same sex. Lesbians are women who are sexually attracted to women. Transgender is a general term for individuals whose gender identity or self-expression of male or female is different from their biological sex assigned at birth. Transgender is a general term for individuals whose gender identity is different from their biological sex as assigned at birth. Gender and gender identity pertains to how a person views his or her own sexual identity, and gender identity is not the same as sexual orientation. And then also we have cross-dressers, which is an individual who wears clothing and or makeup and accessories not traditionally associated with their biological sex. They may not wish to have a gender transition and may be sexually oriented to the same or opposite sex. Then we move to violence. Violence is defined as the intentional use of physical force or power, threatened or actual, against oneself or a person, group, or a community. So violence can be either physical, sexual, psychological, deprivation, or neglect. Violence is a learned behavior. And some of the socioeconomic factors that are associated with violence are age, alcohol, prior history of violence, dysfunctional relationships, desire for dominance, power, or control. You can also, an individual, they can also have intimate partner violence, or IPV, which describes threats or acts of physical violence, sexual violence, coercive tactics, stalking, or physical aggression by a current or former partner or spouse. IPV can occur among heterosexual or same-sex couples and does not require sexual intimacy. Sexual violence is sexual activity not obtained by freely given consent. Most victims are female. Most commonly responsible for an assault is a male known to the female. And like I said before, where I just talked about the intimate violence, or IPV, IPV does not require sexual intimacy. And rape. Rape is a violent crime in which an individual has been sexually assaulted without her or his consent. And that is your key factor of the definition of rape is consent. When dealing with rape, the nurse should follow hospital and police policies. You want a careful and factual documentation is essential. You want to follow protocols to ensure that victims' rights are protected and appropriate information is available for legal purposes. Usually a trained personnel or a sexual assault nurse examiner, a SANE nurse, they assist the physicians with collecting everything, and it includes collecting victims' clothing, specimens, and they make sure that it is given to the appropriate officials. So when you're dealing with a rape victim, you need to, as a nurse, follow hospital policy and police policies and ensure that factual documentation is completed. You have emergency advice and counseling includes crisis intervention centers, rape centers, and special telephone services. Post-traumatic stress disorder. PTSD may occur to victims of sexual crimes in weeks, months, or years following the trauma. Early psychological treatment after traumatic events is an effective measure that lessens the negative effects of trauma. And our key nursing interventions when we are interacting with a rape victim in a healthcare organization is to provide emotional support and help to collect evidence. And we have to remember that a person who has been raped should not shower, bathe, or douche before an exam. So remember, our number one thing as nurses is to provide emotional support. My little thing is going crazy on me. Sexual dissatisfaction is the inability to enjoy or engage in sexual activity. It can be caused by a variety of physical and psychological factors. It can lead to relationship problems, infertility, low self-esteem, anxiety, stress, and unsatisfactory sex life. Male sexual dysfunction. It can be related to medical causes, medications, psychological factors, how they treat it, lifestyle changes, medical disorders, medications. They can treat it with Viagra and Cialis. Just remember with Viagra and Cialis, they can have adverse reactions with nitrates. Female sexual dysfunction causes can be related to medical, physical issues, psychological factors, medications, can be related to chronic illnesses such as diabetes, cardiovascular, urinary or hepatic organs, dyspareunia, which is painful intercourse as seen as in endometriosis, ovarian cyst, vaginitis. Vaginismus is a painful involuntary spasm of vaginal outlet muscles preventing penile penetration. Hormonal imbalances, especially with the loss of estrogen as seen with menopause or hysterectomy, and poor vaginal lubrication or decreased genital sensation, such as seen with changes in estrogen and testosterone levels. Infertility. Up to 90% of infertility causes are treated with medications. Infertility is defined as the inability to conceive and produce live babies after adequate sexual exposure. It's defined after 1 year of trying or 6 months if the woman is 35 years of age or older. 1/3 are related to male-related factors. Another third is related to female-related factors. The cause is unknown in some cases of infertility. Many factors that contribute to infertility is because they inhibit blood flow to the reproductive tissues or cause blockages. And sterility is the absolute inability to procreate. A woman does not have or is unable to produce eggs, and the man may not have or is unable to produce adequate amounts of sperm. Male infertility. Normally, volume of semen needs to be 2 to 5 milliliters with a density of sperm at about 20 million per mil. The motility, viability, and morphology of the sperm must be within normal limits. Risk factors that affect male infertility can be hereditary, congenital, or anatomical. Could be related to like cryptorchidism, kidney disease, cystic fibrosis, lifestyle, injury, or infection. Infections can cause acute or chronic changes to the vascular system. Also could be related to hormonal disturbances, sports injuries, orchitis, medications, STDs, obesity, psychological factors, alcohol, or smoking. And then also environmental exposures can cause damage or death to reproductive system. Just remember, because external environmental temps can affect sperm production, chemo and radiation, exposure to mercury, lead, or pesticides. How do they treat it? With medications, surgery, or they can also use artificial insemination. So, question. If a man is infertile, it means he is also impotent. Is that true or false? It is false. Although he may be considered infertile, he may or may not be impotent. Infertility refers to the ability to conceive, and impotence refers to the ability to ejaculate. Female infertility. All of the ova that women will ever produce are present in her ovaries at birth. Most common causes of infertility are ovulation disorder, and the most common cause of that one is polycystic ovarian syndrome, related to hormonal imbalances that interfere with normal ovulation. The sperm and the egg may fail to unite, and the fertilized egg may not implant in the uterus, related to like uterine fibroids. Like I said, causes can be polycystic ovarian syndrome is your most common. And then you have primary ovarian insufficiency, which occurs in women greater than 40. It causes the ovaries to stop normal function, and it's not the same as early menopause or uterine fibroids. They're benign tumors or clumps of tissue on the uterine walls that inhibit the fertilized egg from implanting in the uterus. Pelvic inflammatory disease or PID. Serious complication of infections of the female reproductive tract. You can also have displaced uterus, obstructed oviducts, cervical infection or cancer, vaginal infection, or ovarian cyst or tumors may exist. They also may have scar tissue that may exist in the reproductive tract related to chronic infections. Risk factors that affect female infertility, just like for a male, can be hereditary, congenital, anatomical. It can be related to their lifestyle, injury, or infection, and can also be related to environmental exposures. Treatment, they can use commercial over-the-counter ovulation kits. They can sperm banks, surrogate motherhood, ownership of frozen sperm, or frozen fertilized eggs. But the one thing that we want to remember with surrogacy, surrogacy involves issues of trust as well as financial and legal issues. So diagnosing causes of infertility, they can do a Rubin test, and that's where the oviducts are inflated with CO2 to determine the patency of the fallopian tubes. They can do a hysterosalpingogram, which is an X-ray study that looks for problems within the fallopian tubes and the uterus. They can also do a laparoscopy, which they can examine the ovaries, fallopian tubes, uterus for disease, scar tissue, or any structural deformities. So just remember with diagnosing causes of infertility, they can do a Rubin test, that's where the oviducts are inflated with CO2 to determine patency of the fallopian tubes. Artificial insemination. That is a procedure that involves direct insertion of semen into a woman's uterus or oviduct. It can be intracervical, intratubal, or intrauterine tuboperitoneal. It is not a form of assistive reproductive technology because it does not involve a transfer of eggs. It only involves the distribution of sperm. And it is used if sperm count is low or a woman's body interferes with the sperm motility. We have assisted reproductive technology, ART, or in vitro fertilization, which involves removal of a woman's egg, which are surgically taken from her ovaries and combined with sperm in a lab for fertilization. AI and ART involve procedures that are invasive, expensive, and not always successful, and are not attempted unless other methods to induce pregnancy are non-productive. Surrogacy, like I said before, involves issues of trust as well as financial and legal issues. You can have a gestational carrier, the surrogate, when intended parents give their embryo fertilized from their own egg and sperm. Success rates should be considered because the process is emotional, time-consuming, and expensive. Factors that affect the success rate are age of the couple, reason for infertility, the type of ART chosen, whether they use fresh or frozen eggs or embryos, and also the clinic chosen for the procedures. Types of assisted reproductive technology. IVF is in vitro fertilization that removes a woman's egg and combined with the sperm in a petri dish. Fertilization of the egg by selected sperm outside the body. Embryos are left in the petri dish for 3 to 5 days, then implanted in the uterus. The most common complication with ART is multiple pregnancies. So that is one of the most common complications with ART is multiple pregnancies. And then you have ZIFT, the zygote intrafallopian transfer, or there's another one called a tubal embryo transfer, the TET, where that uses fertilized eggs that are transferred via a laparoscope into the fallopian tubes. So the difference between ZIFT and TET is the date of implantation after fertilization. So the difference between TET and ZIFT is the date of implantation after fertilization. There's also GIFT. GIFT is a gamete intrafallopian transfer, and that's where they transfer unfertilized eggs and sperm directly into the fallopian tubes via an abdominal laparoscopic procedure. There's only a few clinics that perform that procedure. Then there's also the intracytoplasmic sperm injection, and that's used for couples who have significant difficulties with sperm or with an older couple. And that's where a single sperm is injected into a mature egg. And after fertilization, it is transferred to the uterus or the fallopian tube. And then there's the ESET. ESET is the elective single embryo transfer. It uses one selected embryo taken from the embryo after successful IVF. It's placed in the uterus or fallopian tube, and it avoids multiple pregnancies. So the ESET is one they can use if they want to avoid multiple pregnancies. Problems with assisted reproductive technology, though, is multiple deliveries, preterm deliveries, low birth weight, infants, high cost, and resources needed to care for these high-risk newborns. Contraception. Most common types of birth control. Continual abstinence is 100% effective method of birth control and protection against STDs. Withdrawal involves a need for tremendous awareness and discipline control. It is 80 to 90% effective. Fertility awareness method or natural family planning, if a religion does not allow birth control, or partial abstinence involves determining when an egg is released from an ovary. It is reliable only for women who ovulate regularly. It is 75 to 99% effective. Breastfeeding is fairly reliable for first 6 months. Oral contraceptives, birth control pills, prevent ovulation. The progestin only must be taken at the same time every day to help maintain the needed hormonal levels. Contraindications for oral contraceptives, though, can be high blood pressure, heart defects, blood or clotting disorders, women who are over 35 years of age, and smoking, obesity, and diabetes. One thing to remember, though, many forms of contraception do not protect against STDs. The only 100% effective method of birth control and protection against STDs is continuous abstinence. Side effects of birth control pills can be nausea, weight gain, swollen and tender breast, spotting between menstrual cycles, lighter periods, mood changes, chest or abdominal pain, headaches, blurred vision. They can also have blood clots. They can have an embolus, which is a traveling clot, or a pulmonary emboli, which is related to blockage of vessels in the lung. Most common types of birth control are your emergency contraception, which is a morning after pill. It can be used up to 120 hours after, but less effective after 72 hours after sex. They have transdermal patches. They can change once a week times 3 weeks. There is also birth control implant, which prevents ovulation and increases cervical mucus. With the birth control implant, though, you do want to monitor for infection at the site. We have Depo-Provera, which is an injection that is given once every 3 months. It prevents ovulation. If pregnancy does occur, it's most likely in an ectopic pregnancy. Contraindications for Depo-Provera are cancer of the breast or reproductive organs, history of strokes, liver disease, blood clots in the legs, bone fractures, and pregnancies. And then they have a vaginal ring that they can insert the ring once every 3 weeks. It is 98 to 99% effective. And then we also have intrauterine devices or IUDs, which inhibit sperm ability to reach eggs or prevent ovulation. It can prevent fertilized ovum from implantation in the uterus. It can monitor what you want to do if Educate your clients if they do have an IUD that they need to monitor the presence of the string at least once a month. And contraindications for an IUD is history of STDs, PID, pelvic tuberculosis, pregnancy, and etc. So we also have mechanical methods or barrier methods, which are we have mechanical barriers. Males is condoms help prevent STIs as well as pregnancy. For females, they have the cervical cap, which they can leave in place for 6 to 8 hours after sex. They have the sponge, which they can leave in place for at least 6 hours, but they need to make sure they remove it within 30 hours. They have the diaphragm, which must be inserted each time before intercourse. Risk of the sponge, though, is toxic shock syndrome if it is left in greater than 30 hours. And then there's chemical barriers. Chemical barriers are spermicide, which immobilize or kill sperm and block the cervix to inhibit sperm from traveling to an egg. It's available as creams, vaginal foams, gels, and suppositories. It is not very effective as the only contraceptive method. Sterilization, you have non-surgical methods, you have chemical, hysteroscopic tube insertion. Chemical is permanent. There's also surgical methods such as the tubal ligation. That is your most common and effective procedure. There's also abortion, hysterectomy, vasectomy. Vasectomy is very common and relatively easy and has very few complications. So tubal ligation is for the woman, refers to removal of some or all of the female reproductive organs, where vasectomy is performed for the man. Like I said, surgical procedures are more invasive than non-surgical birth control methods because complications can occur, including hemorrhage, infection, or reactions to anesthesia. The benefits of sterilization include the knowledge that sexual intercourse need no longer be associated with the fear of an unintended pregnancy. The disadvantage, though, is the possibility of future life changes. Sexually transmitted infections. So, according to the World Health Organization, they refer to them as sexually transmitted infections because not all infections are diseases with specific unpleasant side effects. So, sometimes you'll see them listed as sexually transmitted diseases, and the World Health Organization actually uses the term sexually transmitted infections. There are at least 25 types of STDs that exist, and the etiologies include they can be bacteria, parasites, or viruses. Your chances of an infection increase if you have HIV and other STDs. They have few, inconsistent, confusing, or no symptoms. They can be cause major side effects and or death in newborns. Sexually transmitted infections can cause infections that lead to PID and or infertility. And they can cause infections of the mouth, the throat, respiratory tract, urethra, and reproductive organs. Sexually transmitted infections can cause infections that reoccur when re-exposed. Are most common in sexually active young adults between the ages of 15 and 24. They account for half the cases of STD, especially for chlamydia and gonorrhea. and it's related to more sexual partners and unprotected sex. And sexually transmitted infections are less common in individuals who are tested for STDs and who are in monogamous relationships. So a person with the STD who is exposed to HIV is 2 to 5 times more likely to acquire HIV than is a person who does not have an STD. An HIV infection can mimic many other illnesses. Diagnosis by lab testing is the only accurate HIV detection method, and symptoms that women have when they are HIV positive frequently differ from symptoms men have. For females, it often appears as common female problems like a yeast infection, abnormal pap smears, pelvic pain. It can be early symptoms of HIV infection in women. So, signs and symptoms of HIV could include rapid weight loss, night sweats, enlarged lymph nodes, severe diarrhea, and purplish blotches on or under the skin. So signs and symptoms of HIV can be rapid weight loss, night sweats, enlarged lymph nodes, severe diarrhea, purplish blotches on or under the skin. Chlamydia has the highest risk of infertility. Chlamydia is transmitted during vaginal, anal, or oral sex, leading to infections in the associated tissues of these areas. Some signs and symptoms include infertility. Sorry about that. Some signs and symptoms include urinary discharge, infertility, rectal pain, discharge or bleeding, swollen lymph glands in the infected area. Approximately 50% are asymptomatic. That's why it's called the silent STD. So 3 out of 4 women have no symptoms, and half of men have no symptoms. If symptoms do occur, it usually occurs 1 to 3 weeks after exposure. They can have dysuria, vaginal discharge, dyspareunia, PID. They can often have epididymitis for the males. Untreated, it can lead to urethral infections, pain and swelling in the testicles. They can have a watery penile discharge and painful urination. And to treat it, they usually treat with erythromycin and doxycycline, or azithromycin. They can treat it. Let me start this over. They can treat it with azithromycin and doxycycline or erythromycin. 40 to 60% of individuals infected with gonorrhea are also infected with chlamydia, and if they are, then you're going to treat with ceftriaxone. Chlamydia can cause preterm births, newborn pneumonia, and conjunctivitis, which is also known as pink eye. Gonorrhea. Gonorrhea can spread through sexual contact and can be spread from one part of the body to another. Typical symptoms in men is a burning sensation during urination, yellowish white discharge from the penis, or painful or swollen testicles. Without treatment, it can spread to bones, joints, and bloodstreams. Approximately 50% of women are asymptomatic. How we treat it is with bed rest, sitz baths, and antibiotics. And 40 to 60% of clients are also infected with chlamydia, so all partners must be treated. And during delivery, it can affect the infant, so an untreated infant can lead to blindness, joint infections, and/or sepsis, and they treat it with that's why the infants get the antibiotic drops to the eyes as newborns. Syphilis. Syphilis is spread by direct contact with a syphilic lesion via vaginal, anal, or oral sex. Symptoms: within 10 to 90 days. A canker may appear in the penis, anus, inside the vagina, etc. Wherever the syphilis has entered the body. It can last 3 to 6 weeks and heal without treatment. Secondary stage is 2 to 4 weeks after initial infection. It can last 2 to 6 weeks. They can have a macular copper-colored rash that appears on the abdomen, soles of the feet, palms. Wart-like spots develop on mucous membranes. They are extremely infectious. They may have fever, headache, sore throat, and also this stage ends spontaneously. The late syphilis or latent stage, infection is dormant without causing symptoms, may last several years to several decades. And the latent stage begins when the primary and secondary symptoms disappear. The first and second stages, the client is highly infectious. The best treatment for syphilis at any stage is a large dose of intramuscular benzathine penicillin G. Treatment can destroy syphilis organisms at any stage of the disease. However, the drugs cannot reverse any damage already present. Syphilic damage is irreversible, and individuals with tertiary syphilis are not infectious to others. So, blood test. They can do for syphilis, they can do a venereal disease research lab that's primarily performed on CSF and used to detect neurosyphilis. They can do a rapid plasma region. They can do an enzyme immunoassay, troponin, palladium particle assay, or a TPPA. And then the fluorescent antibody absorption. Those first 5 are most commonly used to screen and diagnose infection. The last 2, they can do a dark field microscope, which they just use a specialized microscope to view the samples. And then they can do a Wassermann test, which is a diagnostic test for syphilis using a specific antibody reaction. Chancroid. So a chancroid, do not confuse with canker, which is a painless hard lesion, which is often the first indicator of syphilis. A chancroid is caused by the organism Haemophilus ducreyi, which is a painful genital ulcer. A chancroid is almost always spread by sexual contact, especially in hot, humid areas. Symptoms occur most often in men, but women may be carriers, and they treat it with antibiotic therapy. Simplex virus. You have herpes simplex virus type 1 and type 2. Type 2 is more common. Genital herpes infections make individuals more susceptible to HIV infections. Symptoms range from none. Most individuals have no symptoms to mild to severe. The initial lesions of the herpes simplex virus 2 resemble the HSV1, such as fever blisters or cold sores. 2/3 of people who have had an initial breakout will have a reoccurrence. Treatment is there is no cure exists for genital herpes. They can do palliative treatment, symptomatic to reduce comfort, to prevent secondary infection. Antiviral meds can shorten and prevent outbreaks when taking meds. It is clearly associated with cervical and prostate cancer. And during active outbreaks, an infected person should not share food or engage in kissing. If herpes is present, a condom offers minimal, if any, protection against the spread of the disease. Cytomegalovirus, or CMV, is a member of the herpes family. It is transmitted by a close contact. It can be body fluids, intercourse, kissing, tears, blood, saliva, breast milk, urine. It does have a period of dormancy. Usually individuals with CMV are typically asymptomatic. They may have signs of mononucleosis. Mild symptoms could be general malaise, upper respiratory symptoms, pain, fever. Most common could be retinitis. Treatment is symptomatic relief, bed rest, or acetaminophen. There is no specific treatment or vaccine for CMV currently. And then we have our HPV. So these are, there are about 100 varieties of HPV. It is one of the most commonly reported STD. A vast majority don't even know they have HPV and can spread it to others. HPV can be a predisposition to cervical cancer. And also prevention. The best form of treatment for HPV is prevention via immunization, or, of course, abstinence from sexual activity. But clients who choose not to abstain should consistently and correctly use latex condoms for better, but not 100% protection. Other STDs, you have candidiasis, which it is a fungal infection caused by yeast. They can treat that with over-the-counter miconazole or prescription nystatin. Symptoms of that include pruritus or pain. They can have trichomoniasis, which is caused by a parasitic protozoan. It is common in young women, less frequent in men. Signs and symptoms of that is itching or burning. They can also have copious, foul-smelling, green, yellow, or gray, frothy, or bubbly discharge. Frequent burning, painful urination, but they may not have any symptoms at all. They usually treat it with Flagyl. And irritation of the vaginal walls can also contribute to the growth of trichomoniasis. So remember that irritation of the vaginal walls can also contribute to the growth of trichomoniasis. They also can have bacterial vaginosis, which is inflammation and possible bacterial infection of the vagina. Causes of that could be soap, bath oils, frequent douching. They may have symptoms or may have like a stale fish disorder, or may have a stale fish odor with discharge. Without treatment, it may result in PID and sterility. And then we also have pubic lice, also known as crabs. So, and last but not least is our CDC guidelines for immunizations against HPV. All boys and girls ages 11 or 12 should be vaccinated. We should vaccinate males through age 21 and females through age 26 if these individuals were not vaccinated when they were younger. We should vaccinate any man who has had sex with a man through age 26, and vaccinate individuals with compromised immune systems, such as if they have HIV or AIDS, through age 26, if they were not fully vaccinated at a younger age. This is chapter 70. If you guys have any questions on this chapter, please don't hesitate to shoot me an email. I will try to respond as quick as I can. And I will send you guys out a just a quick email with everything on this also. And good luck. Have a great week. And I will see you guys soon. Bye.